when you become part of the CKD family, you start talking things like BX, and only we know that it's biopsy, transplant, dialysis, and everything like that. But actually, we have so many problems, and I do believe if the good Lord has brought us till here, He will give us solutions. So the solution for Kamal, of course, after his transplant failed, was that he needed to get on dialysis. And you can do dialysis through catheters and things like that, but the best way, of course, would be through a fistula, where your artery and your vein is joined, and that's where it's pricked every day and you go through your dialysis. So our next guest will give us an insight on how patients can preserve their vascular access for long as it can be, lifelong. Dr. P.C. Gupta has an MBBS from KFMC Pune, the Armed Forces Medical College, and a post-graduation from PGI Chandigarh. Has a fellowship in vascular surgery from Nagoya in Japan, and is one of the top and foremost vascular surgeons in our country. Kamal had to give up his peritoneal dialysis in 2004. Dr. Narayan immediately instructed Kamal to go to Dr. Gupta and said, "It will be done, don't worry. He is a magician. It will take only 30 to 40 minutes." While this was happening, Kamal being Kamal would obviously have a little hitch. Something had to go wrong. It's like that only. It's like that with all of us. In that vein, there was a block. And I have to say that Dr. Gupta didn't give up. And he created Kamal's fistula, which is still working, the lifeline of all CKD patients. Dr. Gupta, I can't thank you enough, and can you please come on stage and speak to us?
Thank you, Anjali, and good afternoon, everyone. I think as Dr. Rajshekhar said, our patients teach us. And for us as surgeons too, it's a journey where we keep learning from our patients. And I think if we keep our eyes and ears open, that is how we tend to become better and better. I think Kamal, you've had your fistula now for about 20 years? 17 years. Yeah, so what I have done for him was a little unconventional. Nothing that, I don't think I've ever done that particular procedure for anybody else. But then, that is what was required at that time, and it seemed to work well. So what I tell my patients who have developed CKD and they come to me for some opinion, or patients who are diabetics and I'm seeing them and do not have CKD, it's very important to preserve their veins. And there are quite a few very eminent nephrologists here, and I must tell them that it's very, very disheartening when I see their patients in the wards with IV cannula in the veins which are supposed to be used to make AV fistulas. I mean, it's like writing off the lifeline of that particular patient. And it makes vascular access so much more difficult for a vascular surgeon. So try and preserve the veins. We tell anesthesia colleagues, we teach the nurses, by and large, try and preserve whatever vein might be required in future for dialysis. Diabetes is so rampant in this country. I don't know next year who's going to turn a diabetic, and diabetes, who is going to end up with CKD and require dialysis in future. Second, if you've got to do well on a fistula, the first fistula should be the best fistula. So which means you get your fistula made when your creatinine is maybe 3.5, 4, and not wait till you require dialysis. Because once you require dialysis, you end up with central lines. Central lines invariably damage the veins inside, and then the fistulas don't work as well, or we have to keep doing procedures to keep them going well. So make a fistula while we still have time, maybe 4 months, 6 months before dialysis is required. Choose your surgeon well. I think that's vital, because I get patients who had 3 attempts, 4 attempts, 5 attempts at fistula creation. And it's not only CKD, I mean, for so many diseases, we get to see patients after they've gone through procedures which should have been done differently. And I just tell them that when you call a plumber to your house or you call a carpenter to your house, you probably get a reference from at least 3-4 people asking, does he do a good job? Is he reliable? But have you done that for your surgeon? Most of them don't. They just walk into any place and don't know what that surgeon is going to offer. Not everybody who does fistula surgery or any surgery for that matter takes enough care to do that well. So choose your surgeon wisely, and when you get into the CKD community, as I might say, it's a huge community now. Talk to people, find out from them who does a good job, choose your surgeon wisely. And after that, of course, a lot depends on the nephrologist who's taking care of you. A lot depends on the dialysis technicians and nurses who take care of you, the way they handle the fistula after that. Other than that, I don't think really much you can do. The final thing I would say as far as fistula is concerned is surveillance. Keep seeing your surgeon after, let's say, every few months or at the advised interval, so that a fistula which might be failing can be picked up and we can prevent it from actually failing. A failed fistula is difficult to salvage, a failing fistula is much easier to salvage, and we can continue with that. And finally, how can one do well in life? I think Kamal is an outstanding example. Being positive towards whatever adversity you face is really what brings out the best in you. And I think most people really shine when they decide to take adversity heads on and try to do better than what they would otherwise do. So I'm happy for you, Kamal, that you are doing well. And I think as far as CKD patients are concerned, you are the silver lining for them. And thank you so much for inviting me.
So we all know that nothing's in vain, right? When we do things right.